Good evening, students. So today we are going to discuss why exactly the pulse volume increases in old age, right? In old age, overall cardiac performance is less, overall cardiac contractility is less, but still the pulse volume increases. Why that is the case, right? For understanding this, also you need to first of all visualize, right? You need to visualize an air pump which is connected to an iron pipe and a plastic pipe one by one. Let's see, right? So our question is, why in old age you get high volume pulse despite the reduced cardiac performance, right? So let's take the analogy of a motor, right? Some kind of pump. Let's connect first this motor to an iron pipe, right? Let's suppose this is an iron pipe, right? Now, if you increase pressure inside this iron pipe, right? If the pressure is increased inside this iron pipe is obviously not going to expand. If this doesn't, if this iron pipe doesn't expand, that means the pressure is going to increase exponentially. The overall pressure is going to increase exponentially, right? Suppose the pressure is reduced inside this iron pipe. Now this iron pipe can't contract. So the pressure in that case will reduce exponentially, right? So in iron pipe, the pressure variation is going to be more, right? Now let's the case, the same motor is now connected to a plastic pipe. Let's take the case of plastic pipe. Right? Now if the pressure is increased inside this plastic pipe, this is going to actually expand. This is going to actually expand. So the pressure rise will be there, but it will be much smaller compared to pressure increase inside the iron pipe, because this plastic pipe can actually expand, and when the pressure is reduced, right? When the pressure is reduced inside, this plastic pipe is also going to contract, right? So understand now, if the pressure is increased, this plastic pipe is going to expand, right? And if the pressure is reduced, this plastic pipe is going to contract. So it will mitigate both the rise in pressure and both the fall in pressure. So pressure is not going to increase that much, and pressure is also not going to decrease that much, because it's going to adjust its volume according to the pressure, right? So with this analogy we can understand. Now this iron pipe, that means we can relate it to stiff arteries. Stiff arteries. So stiff arteries are found in which age group? Young age or old age? In old age group, right? And why the arteries get stiff in old age? Because the elastin gets fragmented, right? Because of the fragmentation of elastin. And also because of atherosclerosis. Right? So what will happen? In old age, because of fragmentation of elastin, you will have stiff arteries These stiff arteries will be like some iron pipe, right? If the pressure is increased during systole, it is not going to expand to accommodate it, right? So systole will be high. When the pressure reduces during diastole, it's not going to contract to accommodate it. So even the fall in pressure will be high. So your systolic blood pressure will be high because it's not going to expand to accommodate it. Your diastolic blood pressure will be low because it is not going to contract to accommodate according to the lower blood pressure. So your pulse pressure is basically systolic blood pressure minus diastolic blood pressure, right? So the pulse pressure, since the systolic is increasing and diastolic is decreasing, so your pulse pressure is going to increase, right? So your pulse pressure is going to increase, and as we have discussed in our previous videos, that volume of the pulse, right? Volume of the pulse is directly proportional to pulse pressure. Volume of pulse is directly proportional to pulse pressure. Pulse is directly proportional to pulse pressure, right? Since the systolic is increasing and diastolic is decreasing, the pulse pressure will increase and the volume of the pulse will also increase since the pulse pressure is increasing, right? So as simple as that. In old age, you got fragmentation of elastin and atherosclerosis, which is leading to stiff arteries. Since the arteries have become stiff, so they are not going to expand in case of systole. The systolic pressure will increase. They are not going to contract in diastole. So even diastolic pressure will decrease. Systole is increasing, diastole is decreasing, so your pulse pressure will increase. Since the pulse pressure is increasing, the volume of pulse will be more, right? As simple as that. Okay, so hopefully this video helped you in understanding why exactly the pulse volume increases in old age. Wish you all the very best. Thank you.